this area are safe and that the people that are being watched are no danger to the public.
Okay, NBC's Mark Potter covering things from Dallas for us. Thank you, Mark, very much for that. Joining me now is Dr. Amy Edwards. She's an infectious disease specialist at University Hospital's Case Medical Center in Cleveland. Dr. Edwards, thank you for joining us. Let's talk about the symptoms of Ebola, which are similar to other illnesses, simple ones like the flu. How are hospitals like yours prepared to distinguish symptoms of Ebola from other illnesses?
Well, on the level of symptoms, you can't really establish a difference between something like malaria, typhoid fever, the flu, Ebola, and so it really comes down to taking a very careful travel history, a very careful contact history whenever you have a patient who is exhibiting symptoms in an emergency or outpatient setting that you think might be concerning. We just all kind of have to be a little bit more on our toes and making sure that we're taking those very thorough contact and travel histories on all of our sick patients right now.
Dr. Edwards, the latest update we have on the Ebola patient is that he is in the hospital and he's on a ventilator. What does that tell you about his case?
It tells me that he is getting sicker, which is not unusual in patients with Ebola virus. The virus is very aggressive. It can attack a lot of different body systems, including the lungs, the kidneys, the liver, the heart. And the things that we can do are limited. We can support these body systems by using a ventilator for the lungs, by using dialysis for the kidneys, but the body has to fight off this virus and repair itself. And so what that tells me is that he was probably having trouble with his oxygen levels, maybe having trouble breathing, and so they're just helping him out. And it is concerning, but it's not completely unexpected.
Okay. And Dr. Edwards, is it reasonable to suggest that the sooner one gets treatment for specifically Ebola, the better chance one has at fighting it?
I think that's hard to answer because there is no definitive treatment. Certainly we think with antibiotics and antiviral medicine that the earlier you get it, the better. But with Ebola, it's really only supportive care that we can do. And certainly if we can keep them well hydrated and keep their body as healthy as possible, then maybe they would have a better outcome. But we don't actually know that. There's been so few cases of Ebola before this outbreak that there really isn't a lot of research. But it makes sense to assume that, yes, the earlier you get treatment, the better you might do, but that's hard to say.
Okay. Dr. Edwards, I'm going to ask you to stand by, if you don't mind. As you are well aware, we're going to have a news conference from the CDC shortly on an update on the Ebola virus and the situation here in the United States. I'd like to get your reaction to that news conference. And in the meantime, everyone, we're also going to hear from the NIH's Dr. Anthony Fauci a bit later this hour, including what he says about the vast differences between our ability to tackle the crisis here in the U.S. as opposed to how it is being handled in West Africa. Meantime, switching gears momentarily here, outrage and words of retribution in the United Kingdom today over the brutal murder of British aid worker